that is kept by the discs, then you find that place being very, very rigid. And once it becomes rigid, it becomes extremely painful. So at this point, if we now have two or more of these vertebrae developing osteophytes, then you now find the patient back in severe lumbar pain. And we then might be looking at lumbar spondylosis. There are many other disease conditions around that area that as medical personnel we will have to identify in order to really ascertain what could be the problem around your lumbar region, because the term lumbar spondylosis is a broad-based term and it causes other things too, like spinal stenosis, listhesis, arthritis. Today's class is really going to help us in doing justice to lumbar spondylosis. Now let's look at the anatomy of that particular region, the lumbar region. Just like I said earlier, yours has different vertebrae. Then it goes to your thoracic, and the thoracic houses your ribs, and the lumbar region. So this, now let's look at the happening around lumbar of reduced water content and loss of proteoglycans. I want to take that again. Most of the people that come down with this degenerative condition is as a result of reduced water content and loss of proteoglycans around that region. And what does these proteoglycans do? They play significant roles in cell signaling, tissue organization, as well as joint lubrication and healing. So once your proteoglycans begin to malfunction, or they are not being supplied to those regions, you now begin to see thinning of the discs. Before you know it, you now find stiffness around the development of osteophytes. So we have seen around the anatomy what can lead to it. Another thing that can really cause this condition is loses its height and elasticity as a result of increased mechanical stress. And as a matter of fact, there are so many of us that are engaged in activities that normally brings about serious mechanical stress around the lumbar region. And once there's consistent and persistent mechanical stress, there's every tendency that after a while, before you know it, the osteophyte, once the osteophyte develop, you now find significant neural compression around that area, leading to severe pain. And the pain is something that can be so excruciating. I know some of you listening to me right now might be going through this excruciation around, and some of you may have been diagnosed with lumbar spondylosis, even some of you listening to me right now. And that is why this is our weekly lecture. It's very handy. I can feel the pain of the country director, Chifina, that you're not paying a dime. And there's need for us to read on this information to of thousands and thousands of Nigeria. By right, we should be having millions of people zooming or connecting to us week in, week out. So I can feel the pain of the country director, because Superlife is doing its best to see how we can have not just super life, but super health, as well as the third one, super wealth. So now let's continue. Another thing again that can lead to this degenerative condition could be as a result of the nature of our jobs. I've told you earlier that the nature of how you work can really affect your spine. And once these spines are affected, they become inflamed as a result of the thickening of the ligamentum flavum. It is a particular structure that is located in the spinal canal. The other vertebrae around your spine, they are joined by their neural arcs, and you find this passage in between them called the neural canal. And it is through the neural canal that your cerebrospinal fluid passes through from the spinal cord. So an injury to that section can really be devastating. It can turn a normal healthy person into a vegetable. So when you're beginning to have this secondary changes taking place, um, medically, it is often referred to as facet joint arthropathy, or what is referred to as facet joint arthritis. So once the degenerative conditions begin to happen around that area, it tends to thicken what we refer to as the ligamentum flavum. And I know I told you earlier that around this cord. I know I may be speaking a lot of medical terms here, but there's no way we will be handling topics like this and we will not bring out these medical terms out. So please, I will plead with those who are not medically inclined to just please follow my drift. For those who are medically inclined, I'm sure you will be enjoying today's explanation. Let's look at the epidemiology/etiology. As a matter of fact, the global incidence of lumbar spondylosis is estimated to be 3.63% annually. So that means we are looking at a very high figure where over 619 million people are affected worldwide. So we are looking at a large-scale effect of lumbar spondylosis. So it is not a disease that should be taken kindly. Some of you listening to me, you are even having lower back pain as you are even listening to me now. Now, it is a disease that is highly prevalent in Europe, very, very prevalent among the whites. Though less prevalent in Africa, but we are beginning to see an upsurge in lumbar spondylosis in Africa. So the WHO, World Health Organization, their 2020 report clearly shows that over 619 people are affected, and it is estimated. There's this projection by WHO, World Health Organization, that by 2050 we should be having an increase to about 843 million people globally. So we are seeing lumbar spondylosis, a disease condition that will continue to rise. So, and we cannot be docile, keeping quiet. And that's why a program like this is coming in handy to help us, to educate us, to help us and to educate us. Please, are you hearing me? I want to be sure. Please just go to the chat room and just say, yes, we can hear you. Thank you very much. Then if you look at some of the predisposing factors, one, age and gender. Age plays a significant role in the development of lumbar spondylosis. As one tends to grow older, increase in age, increase in years, you now find the adults lumbar region being prone to the development of osteocytes, which makes that place very rigid and very painful. Apart from that, in terms of sex, this disease condition tends to be more prevalent among the female folks, though it varies from research on this varies from region to region. In Nigeria, in some parts, it is put at 1:1, while in some parts, the females are having more higher ratio, which is 2:1, while in some parts, the men too tend to dominate the women. So it varies from region to regions. So let's go a step further. Let's go a step further and look at the Nigerian situation. In Nigeria, the situation of lumbar spondylosis has increased from 32.5% to 73.53%. Studies that have been carried out implicate age, Yes, as we grow older, our lumbar region tends to begin to crack as a result of so many unhealthy lifestyles that we engage in. As a matter of fact, our own problem in Nigeria is our lifestyle. Our lifestyles are too, it's really pathetic. It's really pathetic. We engage in so many activities that tends to affect our lumbar region. Then, just like I said earlier, when it comes to the issue of sex, it has equally been identified that women tend to have spondylosis from regions to regions. There are three distinct phases of degeneration as far as lumbar spondylosis is concerned. Let's start with the first phase, the dysfunction phase. Now, if you look at the lumbar vertebrae, just like I showed you in my opening diagram, you will see clearly how a normal disc should look like. Now, I had told you earlier again that mechanical stress can lead to a lot of circumferential tear and wear around the annulus fibrosus, which is surrounds the nucleus of the disc itself. That's the intervertebral disc. So once this mechanical stress leads to this wear and tear, it begins to bring out changes and changes in nutrition and as well of hydration. So once it impairs the disc nutrition and there's lots of hydration around that area, you now find the wear and tear taking place. It starts gradually like that. So we refer to this particular stage, this early stage, as the dysfunction phase of the development of lumbar spondylosis. So you find this wear and tear can just begin to start gradually as a result of stress, mechanical stress, or forces that tend to bring about this high rate of reduction and disc desiccation around the lumbar region. So the second one is what we refer to as the instability phase. The instability phase. So because there's continued degeneration, it does not stop with the first phase. There's now continued progression in the degenerative process. So as it continues, one, there's going to be internal disc disruption, reabsorption will be difficult, and there's going to be progressive facet joint degeneration in the vertebral movement. So you now find the patient having a lot of abnormal vertebral movement around that region that is very, very painful. And there's another thing that can occur medically that is referred to as subluxation, which is partial dislocation of the bones around that particular region. So you can see that lumbar spondylosis is not a disease condition that should be taken lightly. That is why those with it, you'll find it, they can't sit, they can't, and in fact, they can't even stand upright. They need a lot of them walk about in order to hold the region in a manner. Will at least give them that next is stabilization. This, if you look at that before me, you can see a normal disc, how it looks like. You can see, just like the phase that we talked about, you can see the degeneration, how it has started. But the two vertebrae that is attached to this disc, osteophytes are yet to be formed. Osteophytes are yet to be formed. Rather, the degeneration started just in the first phase. Then, if you go down, you will now see thinning, the thinning of the disc. Why? Because there's lack of absorption and all those that I mentioned in the second phase, you now find the disc becoming thin. Then in the stabilization phase, you can clearly see the development of osteophytes. If you look at the, all of you listening to me, look at the diagram in front of you and look at the vertebrae down. If you count down, yes, you find, because I told you the lower vertebrae L4 and L5, you are going to see formation, or you can see how the bones are beginning to come out to cover it. So there's reduced mobility. And we are now beginning to see on the patient's lumbar region spinal stings. So there's no way any patient going through this will really be feeling comfortable. Now, we are mentioning all of this. Let's go back to that diagram again. I want all of you to take cognizance, because my brother will really be on this part, because when Coach Sampson comes on board, where it does its repair around the discs. That is why the products we have, this is where and what to do for that. Look at some of the clinical presentation, even though I've told you that, just look at some. Is one where the spinal vertebrae are affected via their around the neural. There's a passage in the middle there called the neural canal. So the longer you begin to have this disease condition, it begins to narrow the spinal canal, that is the neural canal. And once you begin to have narrow neural canal, then you are beginning to look at another condition around the lumbar region known as spinal stenosis. And this cannot, it will really not help the patient. Then there's equally, in my one of my lectures on lower back pain, I mentioned disc herniation. Disc herniation. Let's go back to the diagram so that you can look at it very well. If you look at the herniated discs in the diagram in front of you, you are going to see how the fluids have been pushed out. Why? Because there's a ruptured part there. There's a ruptured part. If you look at the diagram in front of you clearly, there's a ruptured part there. So that is what we refer to a disc, a herniated disc. So another thing that can happen is hypertrophy or the ligamentum flavum. I've already told you that any degeneration around that area can lead to abnormal thickening of the ligamentum flavum. And this is region within the spine again. It is not, it's a structure within the spine, and it will not be healthy for a patient to now begin to have all of those there hardening up. It's really not going to help the patient. So in some patients, the ligamentum flavum may not become thickened, while in some we see it being thickened. So the medical experts and so many other medical diagnosis that we carried out from Chilaka will become explain. That is where the doctors will now be able to ascertain which has taken place. Then there's another one again that we see, another clinical presentation is spondylolisthesis. Spondylolisthesis. And spondylolisthesis is a spinal condition where one vertebrae slips out of place in relation to the other vertebrae. And you now find one up and one below. We covered this when we did waist pain. So for some of you listening to me here that missed the lecture on waist pain, just like the country's director will always advise, I want to suggest that you go back to those lectures. The lectures have all our lectures have been awesome and wonderful. So, and you can go back and listen to it. It will help you. Then the last one there is lumbar radiculopathy. Lumbar radiculopathy. So this one, you find out that the patients begin to have pains, numbness around the legs, and so many other things that lower back pain, the nerves looks as if it is all pinching and all of that. There are so many feelings the patient go through in his or her leg are no longer comfortable again. So these are some of the presentation. So if you are listening to me and you know you are having any of this condition, any of this that I have, please, there will be need for you to contact the country director or any of the medical personnel. Either choose myself, Chilaka, or Coach Samson. We will be more than grateful to be of help. That is why we are here, to ensure that you are in good health. So at this juncture, I want to call on my dependable brother, Chilaka, to take us through this test and management and treatment of lumbar spondylosis. Fam, please. Hello, Fam. Hello, Fam.
We can hear you, sir.
Hello, Fam. Are you
there? I am here, sir. I am here, sir.
Yeah, please, you have the floor.
Thank you.
Hello, Fam.
Yeah, good evening, everybody.
Yeah.
Good evening.
Good evening. You're welcome.
Thank you very much, sir. Thank you, Dr. Rhodes, for that powerful lecture on spondylolysis. Honestly, you have said it all, and I will just say some few things on diagnosis and treatment. Diagnosis and treatment of spondylolysis. Okay, it's as simple as it has been explained by Pro. So how do you diagnose spondylolysis? And just to make it a bit simpler, you must have heard of people complaining of low back pain. It's not your usual one-off back pain or low back pain that sometimes you may experience when you do certain strenuous work, right, or activities that's hygienic. This goes beyond that situation. These episodes in between 6 months and 1 year, must have had recurrent, episodes of pain around that region. And the word spondy, let me just make it easy for us. The word spondy on its own actually connotes the spine. So once you hear spond, right, we are pretty much referring to spine. There are certain medical terms that really know what we are talking about. You don't need to study pharmacy or medical or be so medically inclined for you to know what these terms are suggesting. So, for example, if I say neuro, when you hear the word neuro, what should come to mind is the brain, right? If I say renal, when you hear the word, what should come to your mind is the that you hear on that's kidney, right? Then you hear words like pulmonary, right? Pulmonary, we are referring to the lungs, right? If I mention hepato, that's the liver. So once we also, if we also say spondy means a connote, right? And so if you look at the two terms, spondylolysis, lysis means to break, to split. That's lysis, to split. It is different from lytis. Lytis connotes an inflammation because there is also spondylitis is a full-blown infection, is a full-blown disease, right? It's different from spondylolysis. So lysis means to split. Lysis means to split, to break. And Prof has systematically and skillfully, given us a breakdown on the pathogenesis. I mean, how this problem emanates, how it starts, how it progresses, and how it becomes full-blown. Now, you would have seen some people, especially those who are advanced in age, you see them working bent. There are some elderlies you see sometime in your village or even around the city that are working bent. It's as if they find it difficult to walk straight. All right, those are certain signs of this problem.
All right,
because the low back, the lumbar is a very important part of the bone, right? That is responsible for movements around the oscillatory movements around the lumbar region, which is where you have your waist, what we call waist. And so if there is a breakage or a lysis or more or less like a folding, an infolding or invagulation of that region, you will see it as pain. It's not as if it's completely broken, right? But it's as if it's twisted. It's moving away from its normal position. And what could for that? Prophet, we call it overextension. There's what we call elasticity. Elasticity about the degree of movement or twisting, or how something could be of the degree of stretch, right? Now, when the lumbar is now overstretched somewhat beyond its normal level continuously, right, it begins to affect the integrity of that region. And that is basically what Prof had said all along, right? Now, how do you now diagnose? How would you diagnose? I mean, when you go to a HCP, let's say you are speaking to a family physician, because when you walk into the hospital, the first set of doctors you will meet are the family physicians, or we'll call them the general practitioners, right? You always find them in the GOPD. The GOPD hospitals that are of standard. You have GOPD, or you call it family medicine. When you go to that, you're going to see a GP. Now, the GP is going to ask you some questions. Doctor is as blind as your problem until you open up, right? So it is what you need to the doctor. So, Prof, can you project the slide, please? Is Dr. Egbe here?
Hello, Dr. Ebe, are you there?
Okay, go on. So, when you go see the HCP, like I said, when you go to the hospital, the first set of the family physician to doctor. You have different units. You have, right? Fine. Have infected your blood. That will tell them if or there's an increase in certain numbers of these proteins, eosinophil, the or the HCP, right? We have it is not an organism. Sometimes your body, part of your body is more of a physical or mechanical problem. You know what I'm talking about? It is more of a physical. It is, and diagnosis will also be physical. And so when you go to see the HCP, you're from movement, you to region to know how you are having so much time, move your local examination. It will examine you, right? And then also ask you some questions about your history, because it's hereditary. Hereditary here means that it could be something that is associated, your right. It's something you have around your or within your friends. Did you have any? Can you remember anybody in your family that had experienced these kind of problems? Do you understand what I'm talking about? And they will also ask you the kind of job you do. Because if you're an athlete, because this is usually associated with athletes, people who are involved in strenuous physical activities, gymnastics, body weight and weightlifting, badminton, all those activities that are very strenuous, that all those ballet, all those people, they stretch their body, they can twist and all that. They are the ones that may likely have this kind of, that's why you have it associated more with foreigners, because part of the world, we are not really, we are not a sports people. Our sports activity, our sports industry is right. The only sport that you and I know now is football, and our football is as good as zero. Our football league is nothing. You can't. It's nothing to write home about. We all watch we put on our TV to watch the English Premier League or the Spanish La Liga and stuff like that. When you go to countries like in the US, you see the same attention they pay to football is the same they give to basketball, the same they pay to baseball, right? The American football, you know, that we call baseball, right? Or rugby rather, you know. So so they have a lot of sport events, sport activities, right? And so you are more likely going to have these problems associated with people from there. We are not saying that it doesn't happen here, because we also have people who are involved in various activities like laborers. We have our elderlies at the village, right, who have been involved in strenuous a long time. And so when you travel to some villages, we travel time, some old people, they are bent, they can't walk straight, and the person is still going to the farm. He's still going to the farm. So a lot of them had suffered from spondylitis without knowing, and they don't even know what to call it. They don't have treatment. They don't know what to do. You know, they just sound to say that's not so God want time. You understand? But it is actually as a result of overlay. You have put so much pressure on of your bone, the lump, and if some is now bent. It's now bent, and so the would inform whether it is something that runs in your family, and he also wants to know the kind of job that you do, or if you are involved in physical strenuous activities like laborers, you know, pushers, right? Truck pushers, you have farmers, you have drivers. For me personally, there was a time when I lived in Ikorodu, right? So I moved to Ikorodu. Then my territory of coverage was the island. So but I have appointments with some doctors for 8 a.m. I have to leave my house as early as 3:45 for be on Turbulent Bridge for like. I'm driving. I realized that after a while, right, I will begin to have a very terrible waist pain. My low back will be in serious pain, because a lot of us drivers don't know how to balance our seats. There are certain positions that you need to be on when you are driving. If you miss position, you will begin to put so much pressure on certain part of your bone or certain part of your body without you knowing. And so you notice that a lot of drivers, especially those who have been driving for a long time, who take it as profession, you see them having this kind of problem. You follow what I'm saying? Stretched. And even those of us that work in our offices, I've said this before, bodies facing now, health is consistent sitting down. The human body is not designed to sit. Have you asked yourself why God gave us 2 legs? He gave us 2 legs for a reason. He gave you 1 head. Your hand is in 2. It means you need walk. I mean, it's W-A-L-K. You need to walk. The leg is meant to walk. When you sit down facing your computer or your laptop or watching TV, you're pressing your phone, sitting down for a long time, it affects a lot of so many parts of your body, except your heart. And many kind of for instead of sitting, you should stand. It means if I stand between 8 a.m. and 8:30, sorry, if I sit between 8:30 and 8:30, I need to stand up at 8:30 to 8:35. I must stand up, walk around. For every 30 minutes, there must be an interval of 5 minutes standing, walking. One of the most effective ways of exercising yourself is to walk. Is to walk with your two legs. Walk. The body is not meant to be docile. So if you are living a sedentary life, you may also face this problem. And a lot of us go through this problem because we just want to remain docile, especially our elderlies. Have you observed that those ones at the village that are involved in farming and all that, they seem to have a better health, a healthier life than the ones that have spent all their lives in conditions and they are off by the time they are tired, and within 5 years later, the person is dead. Whereas it's your legs. So while you are working with your brain, facing your computer, take at least 5 minutes every 30 minutes to walk. Just stand around, walk around your legs. That's it for. So the medical examination, there will not be an imaging test. The imaging is important because it is the imaging test that will actually show, it reveal to the HCP, right, exactly how the bone has been positioned, how the lumbar has been positioned. So if there's any extension or overextension, right, of the power region, it will show on the various imaging tests that will be conducted. And because you are 1 minute, please. The RI, you have the trees and all those bone scans. These are basically imaging tests to view, for the HCP to view the position, you know, the position and the formulation, or the formation, right? The position, the actual position of the lumbar and how it has extended. If there is an overextension of the muscles around that region of the bone, there is a deep pressure. Some for a lot of do the CT scan 3 years to a very smart doctor that it doesn't depend business, right? It can review the actual picture of what the bone looks like, the lumbar looks like at that region, right? So that's basically what you do. And then how do you treat it? How do you treat it? So for all I have said, if you remember, I said it's infection. So nobody's going to give you an antibiotics, right? Yes, sir.
I think I saw Dr. Chooks, possibly the area of this treatment. You can now, let's see
it's okay from his own side.
All right, that's
he's
fine.
in the- Okay.
So choose you can help me, sir.
Dr. Chus, are you there? Can you hear us? Doc, can you unmute yourself? Hello, Doc.
Hello.
Okay.
Hello.
Yeah. Yeah, we can hear you, sir. You can.
Okay, can you hear me?
Yes. You're welcome.
A little bit bad here.
Yes, if you can, let's see whether it can be favorable for us to, in the area of the treatment.
Okay, it's talking of Superlife treatment.
Yeah.
Okay, I think Dr. will talk about we have to so that the people will know what we're really talking about. The two of them almost have similar presentation, but they have different to because the problem is on the and we have a special product for that. As far as we administer the stem cell, we also have the NC. Superlife Neuron Care SNC has specially made or has specially combined components that really work on the neurological system of the body, that is nervous system, which includes the central nervous system and the peripheral nervous system. So between the brain and the spinal cord, the Superlife product SNC was packaged for that. So our treatment plan is a combination of the stem cell and Superlife Neuron Care. That is the ST30 and SNC. That's what we give for cases of lumbar spondylosis or spondylolysis. Either lumbar, because the spondylolysis does not only affect lumbar, it also affects the cervical. So it may not be only on the lumbar region, it can also be on the cervical region. So, but wherever it is, as far the region is part of the spine or part of the vertebral column, the treatment of choice or the product of choice is SNC. Now, of course, we know that SNC has a component called ginkgo biloba. Ginkgo biloba. SNC has a component called saffron. SNC has a component called marigold. SNC has a component called Concord grape. SNC also has a component called Vaccinium mytalus, that is bilberry. So these are components of the SNC. Now, research over time and current researches have proven that these components or these phytochemicals, they have ameliorating effects on conditions of the condition of the brain or condition of the spinal cord. That is, components have been found useful abating. So just as the treatment for spondylosis or spondylolysis is not magical. It's not what you just take and expect the results immediately. Because first of all, before you feel pains, there must be a signal through the nerve to your brain that there is either a crack or there is either a shift pressure of the of the cartilages or of the bones in that region of the subvertebral column that goes chemical signal to your brain. So when such things happen, the signal sent to the brain, and that you feel pressure of pain. So what the SNC does, it facilitates nerve inflammatory. When nerve is relievedness to the brain, stem cell will help see how we place the person on 6 months treatment plan on the ST30 and SNC, preferably SNC twice, the ST30 once daily, SNC twice daily for that period of 6 months. Hopefully there will be a massive comeback. If at the end of 3 months, you go for a recheck. I think the best imaging techniques for what we have discussed of recent for the vertebral column, when it involves nerves. It's not all cases that our nerves are involved, but when nerves are greatly involved, we prescribe MRI, magnetic resonance imaging, because the technique uses low energy frequency of long wavelengths. So it's able to get into deeper tissues that CT scan or X-ray cannot get to. So it's good to do that diagnosis so that you're able to know which of the areas you are going to target. And it also helps us to plan our treatment very well. So the length of damage, the nature of damage will help us in planning. So there are some minor pains, leg pain, minor pains that you might place the patient or the client on 3 months. If at the end of 3 months there's no complication, you can extend it. So that is our treatment of our product of choice when you talk about lumbar spondylosis and spondylolysis. So I think I will stop there because of time.
Thank you. Yeah, because of time, just like Doc said, and I so much thank God that all of both Dr. Rove, Thomas Chilaka, and Dr. Chooks, they actually know that we ration time in order to accommodate this stuff. I think beyond reasonable doubt, you can see that a lot has been dished out. And of course, we have been having some fluctuation in the network. I know there will be breaking or something like that, but the recording, we have recorded as much. So we are going to upload it in our YouTube channel as usual. So please, can we go to the chat room and use 3 fire emoji to appreciate Dr. Rose, Famachilaka, and Dr. Chuks? Please, you can hear me. You know that bringing these experts in the medical field are very top. Dr. Rove, like I told us, has been a researcher for a while. If we are to pay him, possibly, I don't know how much each of us should have been putting on ground. Or is it Famachilaka? We are to pay him for this wonderful, and you can see they are speaking from their hearts, sincerely. Then Dr. Chuks is even the one I used in the opening of this tonight's meeting, that he will be visiting us. He's not residing in Lagos. He'll be visiting us. We'll be having him physically in our office, Lagos office, on the 29th and on the 30th. I don't know. I hope we're the fire emoji. I hope I'm seeing them. Sorry.
Director, I've lifted up my hands. I want to share testimony.
Okay, we'll just hold on. We'll once we get there. So, please let's just give it to them as the fire emoji. That's the one we can offer now. That I know we will do much more. We are going to appreciate them both in kind and in cash with time. So, but we pray that the Almighty God who knows how to reward faithfulness in this manner, we reward them mightily. So, and I know that, like I said, this meeting that probably 30, 33 are in the room, how can we, if we are up to 100, the same message passes to 100 persons, or we move it again, if we're up to 300, the same time, the same honorable the experts in the industry area of this thing passes this kind of information, or we gather our family members, all of them hearing the same from the horse's mouth, a lot will go. Let's even start with our family, the immediate family members being in this meeting, then extended family members wherever they are, whether they are in London, whether they are in US or in Asia, any continent, they can connect to this meeting. I can assure you that they will thank you so much for, I know quite a few number of them that have joined us here. Even a pharmacist that joined us last week in the meeting. She herself personally procured good of our products for her own health, and which has been delivered from Malaysia to her in the US. She just confirmed to me that she have received it in less than 5 days. So please be your brother's keeper. Let us extend this wonderful opportunity, wonderful gifts of God by this men that God has given to us. Let's share it and bring them on board. Even if it's our parents, our pastors, name them. They should be on this platform with us. So that even by the time we want to move it to 1,000, I told us that this Zoom meeting is expandable. You can expand it to up to 5,000, not just 1,000. So it becomes a very heavy community. And the more the merrier, because the agenda of Superlife is in our optimal health, for us to be on a preventive side, adopting preventive measure, not a reactive measure like treating our health in a fire brigade approach. So may God help us to borrow wisdom in Jesus' name. So please, we'll give some time for either testimony or questions. I want to let us know that if you need any of our products, please and please, make sure that you just come to identify with the company, either as a customer. First of all, as a customer, you have to you can be a customer first. Being a customer that you want to check out, you want to try the product. If what you have heard about it is true, if the stem cell is truly stem cell, if SNC is really neuron care, does it handle the neuron? At what extent? At what degree? If the supercell tech, that's even the number one thing that Dr. Chus is going to emphasize and talks more about. This device you are seeing at the center, standing, is a powerful device that you will see the impact after you have used it. So as many that are having whether arthritis, rheumatoid arthritis, whichever, osteoarthritis, even all this high blood pressure or what have you, bring them. They will experience it and see. I see the difference. So I think that's the one we are going to start with. And we are going to have a practical section on the 29th. Please make it a date. It's on a Tuesday. Try to get seated 9 o'clock. The moment our seat is filled up, we will not allow more people to loiter around. Maybe you will be scheduled for the next day, which is on the 30th. So if you can be there 9 o'clock, our office open officially 8:30. Get seated by 9 o'clock. So what does it require for you to identify with the company? Only two major things. Number one is your valid government license ID card. Valid. It could be your NIN. It could be your voter's card. It could be your driver's license. It could be your data page of your international passport. Any of these four I mentioned is very good. The next one is your valid email address. These are the two major things. If you have it, we are going to connect you to our company via our database. Meaning that the moment we register you, the company will send you 2 emails. Even give you an email that you can be reaching out to them. So that if there are some things, you can make a finding from them as well. Why are we doing that? Why the company allowed this? You know, our country, Nigeria, before now, happens to be a dumping ground of fake product of Superlife. Our people discover that this product is doing wonderfully, helping people, many health conditions that hospitals have declared incurable. God has been using these products to restore those ones back to life. So now our brothers and sisters went out of their way to China, India, and begin to import fake products. So, but thank God, as it stands now, NAFDAC Nigeria has licensed our products. So we already now know that we are the only legal people to handle Superlife products in Nigeria. And we are asking you, please, always checkmate the source you are getting your products. Anybody that is selling products to you is a suspect. If somebody is asking you, I have product, I'm selling it XY amount, that person is a suspect. And that product is selling to you is not from us. Because a genuine member of Superlife will want to connect you to the company so that you'll be getting the product directly from the company's price. And once you have registered, subsequent product that you'll be buying from the company will be coming to you at the official company's discounted price. How do you see that? That's it. So you can imagine the person that is selling any product out there without telling you about registration. That person is a suspect. I put it in that way. So please be guided. And that's why we have been having so many fora in order to bring this disclaimer. We started it September last year. We invited the media houses in Nigeria in one room at Radisson Blu. And that statement has been made clearly. One of them, which is Punch newspaper, if you go to Punch online on the 13th of September, you can see it Punch published it. It's on out there online on the 13th of September 2024. Go and Google it. We tag that program Celebration of Plant-Based Stem Cell Technology in Nigeria. You are going to see the disclaimer there, meaning that we don't have any relationship with any pharmaceutical store as at date. If there is anyone that we are going to have any relationship with after now, we are going to publicize it. But for now, we don't, because that is where all these fake product sellers went and dumped their products. And innocently, Nigerians have been going to those pharmacies where they have been buying products and buying drugs and see the product there, and they will innocently purchase it. And many of them have started having complications. Please don't be a victim. Don't be a victim. So that's why we have been putting it up. So get registered, enter and get the right therapy that you are going to use for your case. And you are going to see a lot of support. Company has a lot of support in order for you to complete your therapy. Please, once you are coming in with either your health issue or the health of your loved ones, let us know. I'm a director of Superlife in Nigeria. Please reach out to me. You will be assisted in so many ways. So thank you. Even as well, we would like to look into the use the 5 minutes or thereabout for any question or testimony. So can we have the testimony first? Coach Samson, can you please check the chat box so that you identify those questions so that the doctors in the house will respond to them. So, Madam Barrister Ndio, are you there?
Yes, I'm there.
Okay,
yes,
please.
Mine is, since we have 5 minutes, mine is going to be very brief. Thank you so much, our beloved director. I want to use this medium to thank all the doctors in the house. They have done wonderfully well. And it is quite encouraging that I will spread the news, the link for everybody to be joining the Zoom. I just want to testify that 3 weeks ago, my husband had lumbar reduction problem after the x-ray. So I called on Dr. Chooks immediately. He responded and then prescribed STC 30 Neuron Care and our loving coffee tea. So today we are having amazing results, and my husband has testified that he has not seen any product compared to Superlife product. So I want to thank Dr. Chooks most especially for responding immediately. There is no time I call him that he will not respond. And when he prescribed, the clients are always having good results. I want to also thank our dear director here for always organizing this meeting. It's quite encouraging, and I'm going to spread the news accordingly. Thank you so much.
Thank you. Thank you. You're welcome. Thank you. That's a
wow,
good one.
live is super.
So please check. We have a limited time. Check if there are other questions in the chat. Samson, are you there? So why is she? Please just let me know once you.
There's no any questions there.
So those of us traveling from Malaysia.
But the only thing I see that somebody saying that he was trying to convince somebody and he has been saying all those supplements. Well, if that person is listening, or if he cares to listen, tell them you've heard from 3 medical experts about the challenges and how our products can be of help. I thank God, you see the testimony now, relating to what we are discussing today, and somebody is testified just after 3-4 weeks of usage, and you see the wonderful testimony. Though this is not the first time, we've had even a very powerful testimony than this, that even somebody that could not walk, that was brought down to Nigeria from Dubai. And for almost 2 years, the guy was pending. He cannot even stand up. He has gone to so many places, hospitals, even mountains, and they have even resorted it was a diabolic problem or spiritual issues. And the only option is to go for surgery. For somebody to introduce our products. And today the person came himself, walked down to the office himself, and gave the testimony about 2 years ago. So our product is not just mere supplement like no other one. We're unique, and that is why we are Superlife. And there's no two Superlife. There's only one Superlife in the entire universe, and that is the. And all our products are super and powerful. So they are more than even those that are supplementation like SNC, SIC. They are not mere supplementation. You heard Dr. Chus when he was talking about. We have some powerful ingredients in those our products that are beyond a mere supplementation. And the mechanism of action of our products is mere different to the supplementation. Not only that one, even the extractions and the productions of our ingredients, the way we extract our product through the modern techniques of fat tech. That's why you see that all our product comes in powder, not like your usual supplementation that comes in tablet and syrup or capsules. We don't do capsules. We only do a highly organic, 100% organic. That's why it's in powder form, and they are not just mere supplementation. They have ability to really address serious issues, medical challenges, even the ones that are beyond the allopathic medical treatment. So please tell the person I should give it a try, like somebody that just testified today. It's not a matter of just give it a try. It's a practical issue. I always say that when it comes to health, it's a practical thing, it's not theory. You can speak grammar, but the practical is for you to test it, and you see that life is super. So thank you. So don't be discouraged. Keep on preaching the gospel.
Yeah. And thank you, Coach Samson. Like I said earlier, our Leadership International Summit will kicking off on the 2nd of May, which is around the corner here. So 2nd of May, May 2025, that's the first leadership summit taking place for this year, 2025. And the venue it will be in Malaysia. So meaning all the leaders in Superlife world, all of them will converge in Malaysia. First of all, they are going to tour and see the expansion of the ultra-modern factory that was commissioned in 2023. So this summit is that's the first point of tourism. Before then, they will now extend to other areas in Malaysia, which is the home country of our products, our Superlife company. Then those that cannot make it or will not be part of it, please prepare yourself. Let's use this fora, this kind of meeting, and to bring people to be part of it and let them get their get their health back, and they will follow you to do the business because they will spread the good news. Now, the next one is going to be in July. That's Thailand, Bangkok. Is Bangkok in Thailand. So I want to see as many of us that will be part of that international summit. It's a 5-star summit. Then after the July one, the third one, that should be the last for the year 2025, is going to be in November. And it's going to be Turkey, Istanbul. I cannot afford those of us listening to me, even if you have been traveling before now, I want you to just make sure that you test one international Superlife International Summit. You will know that you have never seen such a thing before. It's always heaven on earth. First 5-star treatment, all true. So please, these are a company that is giving you wonderful super health. And they will give you also super wealth. And everything comes together with super lifestyle. That's why you see everything is super. That's Superlife. So you can see that we don't talk much about the complaint here, because we know that once your health is in top shape, once the health of your family members are in top shape, once the health of your friends and business partners are in top shape, just like the popular slogan that we normally say that health is wealth, no any other platform has translated that slogan into reality like Superlife. Health is wealth. We have been using that slogan time without number. But the only system that has translated it is this company called Superlife. So that's why we are not in a hurry to begin to talk about the complaint. Let's, through you now, you know a lot of people are around you that I might never meet, but they are closer to you in your church, in your mosque, in your neighborhood. Point Superlife to them. Let them be in this kind of a Zoom meeting on Fridays, which you know, if you motivate them to be here on time, the data to be in the Zoom, he or she will always receive it. That person will even appreciate you for that. Then the health, by the time they hear this, their confidence level will rise. And when they are using our products, they will begin to see results. The therapy might be 90 days or 180 days. But one thing I assure you that the moment any individual who has any kind of health challenges begin to use our product, the first 24 hours, that person will know that a new life, something that has come to bring back, to restore life, has entered into him or her. Just within 24 hours, even though it's either 90 or 1 year therapy, the first 24 hours, and it will keep happening progressively. The first 1 week, the first 1 month, you will be seeing the progress report. So thank you once again. And I want to return the floor to Dr. Rolf Ebe. He is the man who has been taking a lot of his time to dive into the research, who initiated this movement after September 2024. He is the one that initiated this movement. And since that time till now, he has never failed even any particular week. So, Dr. Rolf, are you there? Hello, Doc. The network? Okay. So I think, can we just unmute? Please remember 29th and 30th. In short, I think 29th as if 30th is not part of it. So I want to see you on 29th. I will personally welcome you. And like I said, you are going to test, have a field test of our coffee, the 5-star coffee called Super Root Coffee, and many other things. So if anything you receive that day is free on the 29th. So see you at the right on time, 9 a.m. latest. Thank you. So can we just unmute ourselves, even as we share the grace and fellowship? 1, 2, go. May the grace of our Lord
Jesus Christ,
the love of God, and the sweet fellowship of the Holy Spirit be and abide with us now and forevermore.
Amen.
Surely, God's goodness and mercy
Fellowship of the Holy Spirit.
all the days of
With
our
us
life,
now.
and we shall dwell in the house of the Lord forever and ever.
Amen.
Thank you. Have a glorious night and weekend.
Yes, sir. Amen. And Christopher.
Don't worry, you let them, like, you don't want to hear it.